Behavioral therapy forms the cornerstone of the management of overactive bladder. So first is, let's understand fluid intake. Typically about 60 ounces, 1800 ml per day is good enough. Unless it's very hot, or if you don't need that much, it's one way or the other, but around about that should be good. Sometimes dryness of mouth as a side effect may make you drink more, so be careful. So don't drink too much. It's just your mouth that needs the water, and we'll talk about that in the next section. Caffeine is a bladder irritant and a diuretic, so it's bad news. So coffee, soda is going to make any one of us go to the bathroom more frequently and possibly have urine leakage. Bladder retraining is very important besides the fluids and what type of fluids you take. So you want to avoid caffeinated beverages, you want to drink appropriately, but you also need to go to the bathroom every 2 to 3 hours. Your bladder is already showing signs of irritability by having the urgency and the overactivity. So you want to make sure that you go frequently, every 2 to 3 hours when awake. The premise is to keep the bladder less full and therefore less irritable. Prompted voiding is for children and elderly who do not remember to go to the bathroom. Then you may want to prompt them every 2 hours. Set an alarm for them every 2 hours that they have to wind down and it comes out, or on the phone app. So then every 2 hours when they're awake, they go to the bathroom. It's not important whether they have the desire or not. They do not need to have the desire. They just need to go every 2 hours on the hour to the bathroom and keep the bladder empty. This achieves two things. One, or actually three things. One, it gives them the habit formation that they have to go to the bathroom and empty it. Number two, it prevents them from leaking because the bladder, before it reaches the level of irritability, she has emptied her bladder. And number three, even if there is leakage, it will not be that significant. Now let's look at the importance of the 24-hour diet. You can see here, she's saying, yep, she has two leak. That means she wet pad or underwear. That's number two. And that's two here. And one is damp pad or a few drops. But we don't know her intake log, right? Now, some people will not give me an intake log. But look at the importance of having the intake log. Now, if you take that thing away, look, she's drinking coffee, Diet Pepsi. Everything is caffeinated. All 80 ounces that she's taking. So she's not only drinking more than 60 ounces, but everything is caffeinated. And that's a bladder irritant. So no doubt she has this problem of urine leakage. That's why it's important to do the diaries. It gives us an idea as to what we need to do. Can I manage it through your fluids or what? Obesity and BMI increase? Yeah. So as you can see, obesity is a risk factor with a relative risk. That means you are 2 times more likely in a BMI greater than 30 compared to women with a BMI less than 24. 2 times more likely to get urgency incontinence. Weight loss clearly helps with overactivity of the bladder, and that has been proven in the bariatric surgery literature. So just as one of the site studies that they did, of course, they're looking at weight loss and all that, but they studied that and they found that even the overactive bladder incidence went down after weight loss. The other important thing is pelvic floor therapy. As you can see right here, the urethra remains tightly closed as the bladder is filling up. Now, when it empties, it's when it relaxes. So you want to freeze and squeeze right here, tighten it up so it doesn't come out, and then get to the bathroom. And once you're in the bathroom, then you let go. That is the beauty of this, which is done with our physical therapist using a machine to help improve the strength of the pelvic floor muscles. It's done in the office once or twice a week for 4 to 6 weeks with monthly boosters thereafter to improve the urethral strength and thereby relax the bladder. Next, we shall talk about the medication management. So behavioral management, now let's talk about medication management for overactive bladder. Thank you.